Welcome to the X Dr. Tommy O Show. The X Dr. Tommy O Show takes a holistic approach to our community's healthcare needs and concerns. Today's topic is one of those topics that is a major concern in our community that is rarely discussed. Tonight we will discuss everything you need to know about organ donation. But before we get into today's show, I'd like to discuss some issues and concerns that are up and coming where Bishop Burkett and myself will be addressing, and that's where we have Toys for Tots as well as Food and Clothes Drive, where we will be coming together at the church offering food, clothes, and toys to children that are in need. So if you have time, please volunteer, make a call Church Alive and ask, I want to volunteer. I want to be a part of Church Alive Community Church and help and volunteer and make a difference in our community. But before we continue, I'd like to address something that we did in the past. This is something where the Bishop Burkett and myself, as well as Bronx Academy of Promise, being proactive, and we took initiative, and we had the Walk for a Cure. We raised money for the juvenile diabetes. There's no one in the community that stepped up like we have, and we made a difference and raised money so we can raise and try to find a cure and awareness for juvenile diabetes. So let's get into today's show. Well, I'd like to introduce a good friend of mine. We grew up not too far away from each other. My guest, Karen Cummings. Karen, welcome to the show.
Thank you so much for having me. It's a pleasure to be here.
Well, it's a pleasure having you here, and it's very important that our viewers see positive role models such as yourself. Before we get into the actual show, talking about the donation, let's talk about your background, especially you have a background in finance and how someone with a background in finance got involved with organ donation. So let's talk about your background with education, because you're a positive role model, and I always emphasize in every show how important education is.
It's key. I am actually a graduate of St. John's University. I majored in criminal justice and decided I didn't want to be an attorney and decided I wanted to go into finance. So I was a financial planner for 15 years and helped people plan their retirements. So that's my background.
So you're going from planning finances
Yeah.
to planning how you can donate organs.
Yes, to saving lives.
So how did you get involved specifically with the New York Donation Foundation?
How I got involved, I've actually been at the New York Organ Donor Network for 5 years. I had a really close friend die suddenly of a brain aneurysm, and we had talked about organ and tissue donation in sort of a weird way, and after she passed away, I really wanted to know more information about it, and in doing my research, it led to an employment opportunity at the New York Organ Donor Network, and I kind of thought it was sort of divine intervention that I decided to do this work. I really wanted to go out to the community and make a difference, and that's how I started to do education and outreach on organ and tissue donation.
Well, that's important, and that's something we have in common, where you have a passion, where we able to find each other, especially the bishop and myself, were those individuals who look to reach out, make a difference in the community. We all gravitate towards each other, and then we get involved with the outreach such as yourself. We educate the community, and this show is about educating organ donation. So with that being said, who can donate organs?
Well, anyone actually can be a donor, regardless of age or race. It really depends on the health of a donor. The recipients are people that really need the healthiest possible organs. So sometimes people think that, they may be at older ages and they're unable to donate. We say, don't rule yourself out, we'll rule you out. If everyone signs up on the New York State Donate Life Registry, then there's more potential donors. That means we're saving more lives.
Right. This is something that we all see on the back of your driver's license. You'll see something like a box to check off, but how many people really get involved and make that step and actually check the box and become a organ donor? Well, what would be the process? I mean, let's say I wanted to donate. What would be the next process, the step in line for me, make a phone call? How do we go about that?
Well, the process is actually simpler than that, and it's not even about checking on the back of your license anymore. Now the way that you can do it in New York State is when you go to DMV to renew your license, the employees there are going to ask you, would you like to be an organ and tissue donor? They're going to have you check a box at DMV, and then in a couple of weeks you get back a form that basically asks you some personal information, if you want to be an organ and tissue donor, and if you want to specify which organs you want to donate. That will list you on the Donate Life Registry, which is a confidential database which is maintained by the Department of Health, which basically lists everyone in New York State that wants to be a donor. In the hospital, when you pass away, they are able to access that database, and therefore they're able to tell your family that that's what your wishes were.
Right, that's important, that national data bank, because this is something where we've been blessed, where God has blessed us, where we can have the ability, even after we pass, to be able to bring life or improve someone's quality of life in the future or their future. Well, is there a need for donor tissue?
There is a lot of need, especially across the country and in New York. Across the country, there are about 103,000 people that are currently waiting for life-saving transplants. In New York, there are over 8,000 people that are currently waiting. The largest need is for kidney donation, and most people, if they're waiting in New York City for a kidney transplant, they wait a minimum of 5.5 to 7 years. So unfortunately, the supply doesn't reach the demand. So we are in great need, and that's why, you know, going out and having these kind of discussions on organ and tissue donation is so key.
Right. This is where we're being proactive here, Church Life Community Church, the bishop and I, as well as yourself, being proactive, stepping up and asking people to get involved. I always say the greatest contribution you can give to your community is volunteering. Well, this is where you can volunteer and give back to the community an organ to make a difference in someone else's life, and where they will pass on the gift when they pass away. Well, let's talk about demographics. Is there a difference between classes or even communities where donations, organ donors are more profound versus other areas, such as like upper socioeconomic groups versus lower socioeconomic groups?
I mean, there really isn't a difference socioeconomically about organ and tissue donation, because that's not what we look at when you list either in the need for a donation or being a donor. That really doesn't come into play. Sometimes in minority communities we are more affected because of diseases that are prevalent, like high blood pressure and diabetes and lupus. You know, a lot of those diseases destroy, you know, the kidneys and the pancreas. Especially in a very highly populated, very diverse area like New York City, a lot of those communities may be higher, you know, have higher effect for organ and tissue donation, but socioeconomically it doesn't really have anything to do with it.
Okay. Well, you always hear stories about the rich. They're able to, you know, throw money on the table and they will be put to the top of the donation list,
Right.
and able to get the organ of choice.
Well, I'll tell you what's interesting is that, you know, how much money you make or who you are does not come into play at all about the need for organ and tissue donation. I think a lot of those stories get more publicity instead of, you know, the everyday person that actually receives a donation or the everyday donor. So you'll hear about the Mickey Mantles or you'll hear about the Steve Jobs because those people are, you know, more in the public eye. But, you know, the way that you are, if you're in need of a donation, in need of a transplant, it's overseen by a board who has medical people and non-medical people, and it's based on how sick you are, it's based on the organ that you're waiting for, it's based on the size of the organ, the blood type. So how much money you have has nothing to do with it. It really has to do with some of those key points as far as you receiving a transplant.
I want to thank the Bishop and Church Live Community Church for allowing me to have the Ask Dr. Tommy O Show. Remember, stay live with Church Alive. Make a difference in our community. Volunteer, make that commitment, and here's a gift that you can give. Become an organ donor. You have the information on the screen. If you don't have that information, or we can easily give you that information, call Church Life Community Church X for Bishop Burkett and say, I would like to be an organ donor. Thank you. God bless.